Coming to the next case, a 60-year-old woman came to physician with a complaint of proximal muscle weakness and hypotonia. On observation, the patient was seen to exhibit waddling gait and knock knees. The woman wears parda regularly and is not exposed to sunlight. Bone mineral density showed lower bone mass and density expected, lower bone mass and the density expected for his age. X-ray shows generalized skeletal translucency with cortical thinning and reduced opacity of bones. Biochemical estimation showed low calcium levels, phosphorus levels and the vitamin D levels. Now looking at the history and her lifestyle and the investigations and age factor, we can come to a probable diagnosis of a case of osteomalacia. Osteomalacia is derived from Greek word where osteon means bone, malacia means softness. This osteomalacia is a disorder in which the bone contains normal amounts of bone matrix but is deficient in mineral content. Such undermineralized bone is structurally weak and more susceptible to fractures. Proximal muscle weakness and hypotonia are common and the patient can have the waddling gait and have knock knees. So this osteomalacia is mainly due to the vitamin D deficiency, which can be seen in this particular case where the biochemical estimation showed vitamin deficiency. In turn, there is calcium and the phosphorus deficiency. Now we have known the functions of vitamin D, that is mainly to maintain the calcium and the phosphorus homeostasis in the blood so that there is normal functioning and also the bone mineralization, that is osteoblastic and the osteoclastic activity. Coming to the biochemical basis, vitamin D deficiency leads to insufficient mineralization and increased osteoporotic changes leading to bone density reduction. It involves generalized reduction of bone density. Bones are softened due to insufficient mineralization and increased osteoporosis. So this osteoporotic changes can lead to back pain, stoop posture, bones become weak and brittle, which leads to easy fractures of the bones. Coming to the assessment, how do you diagnose a case of osteomalacia? Look for the serum vitamin D levels, serum calcium levels and serum phosphorus levels, which can be decreased, and serum alkaline phosphatase levels can be increased due to osteoclastic activity, and also look for the serum PTH levels which are high in a case of osteomalacia. Coming to the treatment, mainly the vitamin D supplementation, as there is vitamin D deficiency, which can in turn regulate the calcium and the phosphorus homeostasis. So supplementation of vitamin D of 50,000 international units per week for 3 to 12 weeks, followed by 800 international units daily as maintenance dose, along with 1 to 1.5 grams of calcium per day is to be given in a case of osteomalacia for the correction of the deficiency of vitamin D and the calcium levels. So this is about the osteomalacia, which is mainly due to vitamin D deficiency.